Dartford and Gravesham NHS Trust is a small to medium-sized district general hospital on the outskirts of London in North West Kent. In terms of the challenges we face providing high-quality healthcare, the constraining financial environment makes it very, very difficult. And to get the benefits of scale that allow you to save money or make significant investments, many organisations choose to merge or acquire each other. But that's very expensive, creates a loss of identity for one of the organisations frequently. It's very difficult to align cultures and it's very, very distracting. And there are many examples of failed mergers. So we began to wonder whether there was an alternative to merger or acquisition and an alternative to isolation and independence by working together in a more structured partnership using international examples of hospital groups which do exist on the continent and in the United States. So the aims of the Foundation Healthcare Group are firstly to think about how our corporate services might work in a different way to save money and to get better value. Question whether the corporate services could work together collectively to release value. It's really important that we try and drive as much money into frontline services as possible. So the corporate services have to be organised in an optimal way. Could we come together and make something better happen and release money and value there? Secondly, could we reduce clinical variation if we work together? Could we improve patient safety if we work together? We've done quite a lot of work around the clinical pathways and we chose to use the relationships that we already had with Guy's and St Thomas's, which is a tertiary centre. A third thing we wanted to examine is whether we could share clinical resources. So as a smaller district general hospital, we struggle sometimes to afford all of the skills that we require, particularly if we need them more occasionally. So our proposition is if we were working with a bigger hospital, could we have a much more formal arrangement to share skills that we might need perhaps on a weekly basis as opposed to a daily basis. So we had a lot of commitment from the top of both organisations and that commitment has been sustained. So chief executive to chief executive, chairs involved, directors involved, and basically committing to regular meetings because you have to put quite a lot of effort into developing the relationship, developing the understanding, making sure you're on the same page and then sustaining that. Because at the start it is it's very dependent on relationships and it's a bit personality driven. So we did actually spend quite a lot of time meeting and talking through the concept. People from Guy's came to Dartford, we travelled up to London and we just committed to putting the effort into the relationships to start with. I think the partnership has worked because our values were aligned. So it's a bit like people. If people are working together, you want to have a sense of shared purpose and value. Same with organisations. We had very similar values as an organisation and that's been really important. I think we've enjoyed working together and found that it's a very positive and creative experience over the last couple of years. Our clinical teams, once they got going, found ways of improving patient care, in making much smarter pathways for patients to travel through between our organisations, bearing in mind that we're a secondary care institution and Guy's is a tertiary centre, so we have patients who flow between both organisations. And I think people really enjoy a sense that they're making a difference and that they're improving their experience as clinicians and they are undoubtedly improving the experience of patients.